Okay, NSCA, Chapter 20. And this is presentation number 4, also known as last presentation. And this is about COPD, which is chronic obstructive pulmonary disease. And then we also will talk about asthma and exercise-induced bronchitis or bronchoconstriction. With clients who come in, they can work out, they can go ahead and be pushed in a workout. But you have to understand that there might be some limitations. Now, some people are more eager and more willing to push themselves along in workouts than others. There are some individuals who will be COPD and, they can come in after perhaps starting off in a formal, as I note here, formal pulmonary or respiratory rehabilitation facility. But afterwards, when they go through this presentation and obtain clearance, you can definitely work with these individuals, and you can work on having whether it's home exercise, as they note here, or working with you in a fitness facility, both are fine and appropriate, but it usually includes we're stopping smoking, we're going to continue with our medical plan and have a high degree of contact with our medical professional regarding our COPD, but also integrating you in as part of the process. Now, COPD is usually caused by smoking, some type of respiratory infection, or some type of air pollutants that people have inhaled during the course of their lives. With asthma, it's and I'm sure you've either, if you don't have asthma yourself, you've known somebody who perhaps you've done sports with who has asthma, and they end up carrying around an inhaler with them, probably a rescue inhaler. And I know when I coached youth football, I had a couple different rescue inhalers that we had right in our little medical kit. One was for John, one was for Jim, one was for Robbie, and like each kid has their own little rescue inhaler. But when it comes down to a medical emergency, there are times where like I don't care, just give me whatever one you grab, and then Jim might be using John's and John might be using Robbie's. To a certain degree, it didn't really matter. But the the main part of this that I want to get across is when we look at asthma, it's a chronic airway disease, and chronic is the key part of that statement because it's something that has gone on for quite some time. Acute is short term, chronic is long term. And much like everything else we've talked about, people who have asthma usually know they have asthma. People who have asthma have had to deal with the effects of asthma and some of the limitations of being asthmatic and carry their own inhalers. They are well aware of what they can and cannot do. They know their good days, they know their bad days. And you, as a practitioner, will be working with these individuals, and they will more often than not be able to articulate to you, hey, I'm having a good day, I'm having a bad day. Things that may have an effect are things like, is the pollen high? Is it freezing cold outside? Are there other pollutants in the air? Like we've had these wildfires sometimes that come over and blow smoke from Canada. A person has pulls up to a stoplight and somebody's smoking in the car next to him. Did that trigger an asthmatic episode? When they talk about bronchoconstriction, they talk about exercise-induced bronchoconstriction, EIB, in the book, and it's a acute, very short term, but reversible narrowing of the airway, and it's caused by perhaps the type of activity, the intensity of activity, or other environmental conditions like it's dusty out, the temperature, or even pollen. And you'll see in the book the term dyspnea, which is a difficulty in breathing or labored breathing. It's kind of like the inability to get a full breath. Now, this one you might need to pause just to go ahead and take a peek and open it up and expand it. I'll get myself out of the way here. And as I noted before, they'll be aware of their condition. They'll have a rescue inhaler on their person. Oftentimes, an action plan is used to assist when somebody goes into an episode. And if their conditions start to deteriorate and they take a puff of their inhaler and they continue to get worse, that's when they put in this asthma and basically enact this asthma action plan that was put in place prior to the workouts. So the AAP, it's a written individualized worksheet that identifies, here we go, the process and actions that will help prevent worsening of the asthma conditions. It also provides guidance when a person needs direct contact with a healthcare provider. So here you are, you're kind of shepherding this person through a workout. You have to have this communication in place with your person. And, you should also encourage your client to have this in place. but also it comes from good conversation with the healthcare provider. So, you have to kind of advocate sometimes on behalf of your clients to get them to speak to their doctor, come up with an action plan, come up with a strategy, and not just be flippant about it and just be like, okay, whatever, but instead, have a plan of attack. God forbid something happens and goes wrong. They do provide an example of an action plan here. And again, I'll let you guys kind of blow this up if you want to. And I'm just putting this up there for your review. But it's kind of like a RPE, if you want to think of it like this, for breathing. You have different zones, green, yellow, and red. And with a dyspnea scale, like a shortness of breath scale, what they're talking about is if a person in their flow rate is at 80 or 100% of their previous best, they're in the green. If they get here to 50 to 79, they're in the yellow. If they're less than 50%, they're in the red. So what conditions or symptoms will be present during that time, like in the yellow, some difficulty breathing, there's a cough or wheezing, some chest tightness, perhaps they're awakening at night because of that shortness of breath. Further down, we get into very much considerable difficulty breathing getting worse instead of getting better, and medications are not reducing the symptoms. So you can kind of use this to evaluate and then come up with your exercise considerations. If the person's in the red, you're not exercising with them at all. Here, you're going to use some caution, maybe remove some of the triggers, get them out of the cold air, bring them inside, get them outside of the pollen or the cottonwood that sometimes falls here in Illinois, and then get them into an air-conditioned area. Do things to be able to help them actually continue their workouts. So I'll just leave this up here. You can pause me and kind of read through this. Because when you look at and work with clients, you'll end up having some people that might not have an understanding of this, and you can use this to help you in helping develop your own asthma action plan with your client. With this scale, they do it like this, which is very much like an RPE, where rating of 0 on one end, rating of 10 on the other, where they have no trouble at all. There's no breathlessness. And then when you get all the way down to the bottom, there's an absolute degree of breathlessness. They can't breathe at all. And you can talk with your people in terms of, all right, are you like a 5 today? I mean, I know we have a lot of pollen outside. They might walk in and say, I'm kind of a 3 today. We need to use some caution on what we want to do. Or they come in and say, nah, it's a nice day out, no pollen, no smoke from Canada. I'm pretty much a 0.5, maybe a 1. You can crush me really good today. And those would be the kind of conversations you have when you work with your clients. So a couple things as we've gone through this chapter, almost to a letter, when I brought up some of these conditions, most of your clients will know about their condition before they meet you. They'll be able to articulate to you regarding their condition when they meet you, and they'll be able to offer you intervention strategies while they're working with you. I would still urge you to operate in the spirit of open communication with your client. And that communication happens when you first see them and they walk in. How you feeling today? How you doing? How are you on your breathing scale, for example? You're a 0, you're a 10. Can you breathe today? And how are you feeling? We talk about like this readiness to work out, which includes have they had enough sleep? Have they had enough water? Did they have anything to eat? But for some of these specialized populations, there might be a few extra questions you have to ask. How you breathing today? How you feeling? Do you have any neuropathy in your feet? Those are very valid questions to ask depending upon the population. And I would urge you to just, as you work with your clients, have that open communication with them just to make sure that you are on the same page as your client as they present for your session and you're meeting them where they are. I'm not saying you want to, in essence, leave them where they are, but meet them where they are at that moment to guide them through a workout that's appropriate for how they feel in the moment. All right, guys, I'm signing off. Have a good one.